Our toxic environment is impacting fertility. But what if a successful pregnancy and a healthy baby started long before conception? Join us for a step-by-step guide to enhancing fertility and preparing a couple for a healthy baby. We've all heard of prenatal care, but preconception is just as important. To talk about this, preconception and its role in successful pregnancies and healthy babies is Dr. Jodie Peacock. Dr. Peacock is a naturopathic doctor with a specialty on fertility. Her book, Preconceived, A Guide to Enhancing Fertility and Preparing Your Body for a Healthy Baby, has been out for a couple of years, and she is the founder of the Canadian Fertility Show. Welcome back to Nutramedica, Dr. Peacock. It's lovely to see you.
Thank you so much for having me back. I appreciate it.
So, I think that this is probably quite a new concept for most people. The idea that we should be thinking about the health of our child even before they're conceived. But as you think about it, it makes nothing but sense. Maybe, can you talk a little bit about the evidence for that? What is the evidence that there is a health impact that starts preconception?
Yeah, so if we look, there is definitely more evidence coming out now about something called epigenetics. And there are some very interesting stats around that. So when, a female becomes pregnant, if they are pregnant with a daughter, they're not only impacting their daughter's health, but their future kids, because the embryo, the eggs in that daughter that are inside your uterus are actually being impacted right from then. And there was one study that found that, as a grandmother of that child, if you smoked during pregnancy, it increased the risk of your grandchildren having asthma.
Good Lord.
We also see similar things around PCOS. If mom is exposed to higher amounts of endocrine disruptors, then their daughter has a higher chance of having polycystic ovarian syndrome. So we know that there are things that, are impacting not just this generation, but your next generation down with the decisions that you're making.
So I know that you've sort of touched on it a little bit so far. You've mentioned diet, you mentioned the environment. So what is the impact that these things are having on the baby? Can you point to the impact that we're seeing in kids?
Well, so basically, as your egg or your sperm is developing, there is kind of a protective fluid that will surround, that egg as it develops to keep it healthy. And if we don't have kind of the antioxidant capacity to deal with any potential damage, we can start damaging that egg right from development, right? And so that can display as, first of all, it could mean that you don't even conceive to begin with. So it's not going to impact your kids because you don't have them. We can see it impact basically kind of the DNA structure. So we could see it display as either, epigenetic concerns or actual chromosomal abnormalities or concerns with baby. And then, from there, it's hard to say 100%, eating a poor diet is going to cause, this particular concern. But I do think a big part of it comes back to your mitochondrial health. So the mitochondria are, if you remember kind of your grade 10 science class, those organelles that produce energy. And if our mitochondria aren't able to produce enough energy, which our mitochondria are very susceptible to toxicity, we don't see proper DNA replication. We also can start to see more concerns with our methylation pathways, which is a very important detoxification pathway in the body. So this can be, might be a connector to where we're seeing more cases of ADHD, where we're seeing more cases of autism, anxiety. A lot of these concerns will link back to that mitochondrial function.
Let me ask you this. This is probably a sensitive topic, and my feeling is that if a couple comes to a naturopath because they're struggling with their fertility, is that the first stop they've made, do you think, or is that the second or third stop they've made?
Well, and so this is something that I'm trying very hard to change the conversation around, because in my opinion, we should be the first stop. right? If you're thinking about getting pregnant, the first place you should go is to see your naturopath. Now, is that what happens in reality? No. Now, would I say that it's changing? Yes, I would say, in the 15 years I've been in practice, I definitely, and I mean, part of it's obviously my passion around it. I'm having these conversations with patients, right, even if they're coming in at 25 because they have acne, we're talking about it at some point. But often what's happening is, we're kind of the last resort. It's like, okay, I've seen the fertility specialist, I've had, 3 to 5 failed IVF cycles. Now what do I do? Right. And so we definitely work with those patients, and oftentimes there is an underlying issue, whether it's, again, inflammatory, there's an autoimmune component, there's something that's been not necessarily identified, and that we can often, work on, and then we can end up having a successful pregnancy. But it would, be a lot better for everyone involved that, that couple didn't have to go through so many failed procedures and spend so much money and heartache before that happened.
I hope you enjoyed that highlight from a recent program on Nutramedica. If you want to get access to our full-length shows and live interactive events, you'll need to register as a healthcare professional at Nutramedica.org. To stay up to date with our latest programs, go ahead and subscribe to this YouTube channel, and don't forget to hit that notification bell. We'll see you soon at Nutramedica.org.